Since the official declaration of the outbreak of Ebola in Uganda in September, government's emphasis has largely been on Mubende and Kassanda districts as the epicenter of the outbreak. Whereas the two districts have been under lockdown for the last 2 weeks, medical response to the outbreak has largely been concentrated in Mubende district, which has recorded the most cases.
And that is one of the reasons why the Mubende ETU is filled to capacity with cases from Kassanda.
However, according to Health Minister Dr. Ruth Aceng, this is now changing, with Kassanda district recording more cases. During a town hall meeting on Thursday to assess the district's response to Ebola, it was found that 12 cases had been registered, down from 5 in the last 24 hours.
And the challenge that you have to note with that is that Ebola cases stay a very long time in hospital. That is why the discharges are few, the admissions are many, the number of cases are growing.
If you look at our matrix, you realize that the people who are getting mostly infected are the ones of 18 to 40 years.
This has been blamed on a number of factors, including the district's weak health system to handle the outbreak. Dr. Aceng points out that the turn in events now necessitates the establishment of an Ebola treatment unit in the district.
We have agreed with partners to support recruitment of health workers to man the Ebola treatment unit that will be set up here,
coupled with the requirement of more health workers.
We have also agreed that we need to beef up the 7 epidemiologists currently in the district, perhaps to a higher number of 15 epidemiologists.
The minister has also called for increased sensitization of the public in order to combat the misconceptions around Ebola.
There is still a lot of myths and misconceptions surrounding Ebola in Kassanda. The people need more and more sensitization.
So some of these things, even the issue of politicking, they are politicizing everything. They think that we are coming to do accountability for the monies we are getting.
During the meeting, residents asked the ministry to consider cutting the 3rd academic term short in order to protect the learners from Ebola.
So we are relying on the education system and the parents. 1, the parents must report. If any child is sick, do not bring that child to school. The schools themselves have to report any absenteeism for us to investigate and find out what is wrong.